explanation, and I think it's helpful for me, I think, in pictures, so it's helpful to have that backdrop of what's actually happening or not happening in the lungs, as the case might be. And this is generally a progressive condition, as you've described. So while I'm sure that makes it a little bit difficult, therefore, to encapsulate the integrative approach at any one point in time, can you give us a sense of whether the integrative approach is also sort of matched similarly? Is it progressive or escalated over time?
In terms of adding more therapies as a person ages in their lung?
Right.
So kind of anti-aging integrative therapies.
Yeah.
So the thing with COPD, with the lungs, we can regenerate skin and grow hair. Mm-hmm. You stopped growing new air sacs at about 2025. Mm-hmm. So that's all you've got. So a lot of people smoke and they're like, I could run a marathon and smoke a cigarette, mm-hmm. no problem. But then it catches up later, mm-hmm. because you have all of the alveoli and lung tissue to last your lifetime. But if you start smoking it away, then you're using up that reserve to age, and then suddenly you're still aging. There is a natural decline in lung function just with normal aging. So there are a lot of integrative interest in diet, nutrition, supplements to see how we can slow down that process, mm-hmm. minimize the oxidative stress mm-hmm. and inflammation so that we don't accelerate that aging process. Mm-hmm. COPD patients, just because of that hyperinflation and that damage that they do by that process and the shearing forces, you want to try to minimize that. So yes, there is a lot of interest and in supplementation with maybe vitamin C, polyphenols, mm-hmm. resveratrol, that's being very, very hotly looked at mm-hmm. in terms of the anti-aging process of the lungs.
Okay, so kind of as in a sense, the way you've just described that is maybe there might be some ways to sort of slow the progression down, yes. with this sort of tissue vitalization approach,
yes.
perhaps.